Bismillah ar-Rahman ar-Rahim. This is the lectures of Crown Bridge. Prosthodontics, it's a dental specialty, was concerned with the making of artificial replacement for missing part of the mouth and jaw, also called a prosthetic dentistry or prosthodontics, same names. The fixed partial denture, called a bridge, it is a fixed dental prosthesis appliance which replace restore the function and aesthetic of one or more missing natural teeth. So the fixed partial denture, it's fixed in the mouth, opposite to the removable partial denture, to replace the missing one or more teeth and return to the aesthetic and function in the patient. The content of the bridge. First, the bridge contains a retainer. Retainer, it's a cover for the abutment natural teeth, the part of the bridge, which is cemented on the abutment teeth, such as a full veneer crown, FVC. Full veneer with the facing. In anterior teeth, the full veneer should contain a facing for aesthetic and maybe retainer such as 3/4 crown. Second, a pontic. Second part of the bridge, it's a pontic. A pontic which replaced the missing natural teeth and restore function and aesthetic. A pontic is a fix replaced of the missing one or more teeth. Three connector which connect the pontic to the retainer. There are two types of connector: movable connector or solid connector, rigid, or these three parts of the bridge: retainer, pontic, connector. The type of the bridge: fixed bridge, fixed movable bridge, cantilever bridge, resin bonded bridge. Number one, fixed bridge. As we see in this picture, the bridge contains two retainer and one pontic, and the pontic connect to the retainer by the connector. It is the most commonly used anteriorly and posteriorly. The pontic or pontics are connected rigidly by the solid joint to the retainer at both ends of the bridge. So we have only one path of insertion. This is the fixed bridge. Second, fixed movable bridge. Fixed movable bridge means that the bridge connect one side with the retainer and the other side with the movable connector, as we see in this picture. The pontic is attached to the fixed retainer while the other side is movable joint which is connect with the other retainer. It is useful in case of tilted teeth where a common path of insertion cannot be got, and also slight mobility, drifting, and difficult to have the parallelism between two abutment teeth. This is the indication for use a fixed movable bridge. The indication: number one, when we have abutment have a tilted, and when we difficult to get a path of insertion, and in case of slight mobility in the abutment teeth, or in case of drifting and difficult to get a parallelism between the abutment teeth. This is the indication of use of the fixed movable bridge. Cantilever bridge contain two types of cantilever bridge. Number one, simple cantilever, usually consists of one retainer, that means one abutment tooth on one side only, indication in missing lateral or premolar. This is the two just indication when missing a premolar or missing a lateral. In this bridge we have a one retainer and one pontic, and connected between them by the one connector, fixed rigid connector. This is used in missing lateral when we have a retainer on the canine. And in case of missing 4 in this picture, we used 5 as a retainer. Spring cantilever, this is the second type of cantilever bridge. The pontic is connected to gold bar, which also connect to the retainer away from the pontic. The pontic away from the retainer, usually used in case of missing maxillary central or lateral on one side of the maxillary arch, which presence of diastema between the anterior teeth. Force applied absorbed by the spring, and when we applied a force on the pontic, the force absorbed by the spring, because we have a long connector, and displacement of the force on it. It is not advised to use it on the mandibular arch, because this is not used in the mandibular arch, because the mandibular arch can't have a palate to use it area for spring and bar. The spring and bar represent the connector, and because the instability of the spring and calculates formation and the lower calculus is has happened in the lower incisors, and tongue discomfortable. All these three not advised to use a spring bridge in the mandible. Number 3, resin bonded bridge. Conservative bridge. This is a bridge called a conservative bridge and may be called a Maryland bridge. There is minimal preparation within the enamel used for short span, 3 unit, less retentive than other type, and we use the composite as a resin for cementation to the abutment teeth. It is contraindicated in heavy occlusion can be used this bridge, and decrease the overjet. In case of the decrease of the overjet can be used this bridge, because the overjet will lead to more load on the bridge. In case of attrition, in attrition we have the overload on this bridge and will lead to failure of this bridge. Large surface of the pontic can be used this bridge, and edge-to-edge patient. In edge-to-edge patient can't use this bridge because the bridge will have a failure because due to overload on this bridge. This bridge have a two wing. The two wing cemented on the adjacent teeth by the resin bond cement. by using acid etch and bond of the prepared palatal surface within the enamel, just within the enamel, not deeply prepared to dentine, because the dentine is weakly bonded. Indication of fixed partial denture: restore function and aesthetic. It's very important to restore the function and aesthetic, mastication and aesthetic, and phonetic. Restore speech, phonetic, especially in the lower anterior teeth. Prevent over-eruption and drifting of the opposing and adjacent teeth, which may lead to premature contact and temporomandibular jaw disorder. Replacement of the missing tooth. It's to prevent the over-eruption of the opposite teeth to the missing and drifting the adjacent teeth to the side of the missing teeth. So should be replaced immediately to prevent over-eruption, drifting of the adjacent and opposing teeth. Recounting of the occlusion. Recounting of the occlusion: tooth surface proximal contact with the adjacent tooth and prevent food impaction. Number 4, in case of the missing teeth, the adjacent teeth will drift and tilt to the missing area, and we lose the contact area between the adjacent teeth with the adjacent teeth at the one side. So we have food accumulation and periodontal problems. Indication of fixed partial denture: 5, act as a space maintainer. Space maintainer to keep the space without lose of this space. So we know when we're missing a teeth, the adjacent tooth will tilt and close the space with the time. So the bridge will keep this space and called it a space maintainer. Correction of disharmony exists between the teeth and the TM joint. So in case of missing teeth, the tilting and over-eruption and the drifting will lead to TM joint disorder and difficulties in the harmony of the teeth. 7, partial denture splinting. A fixed partial denture can be used to stabilize the tooth in a condition, act as a prevent and increase inability, but not eliminates it, providing there is an health suitable abutment to distribute the masticatory force on them. So the replacement of the tooth will aid the other natural teeth in the mastication and to prevent overload on the abutment teeth. The fixed partial denture can be used after orthodontic treatment to replace the missing teeth. After correct drifting and tilting teeth by the orthodontic can be used a fixed partial denture. Advantages of the fixed partial denture over removable partial denture. Fixed partial denture, it's easily to keep clean in the mouth by the brushing dental floss. There is a point contact between the pontic tissue while the removable partial denture should be removed from the mouth and clean. So the fixed partial denture cleaned as a normal teeth by the brush and dental, but the removable denture should be remove it to clean it. Second, more stable fixed partial denture more stable, more comfortable to the patient because it cover less tissue surface, no acrylic flange, no base, no clasp. 3. Better aesthetics, especially when porcelain materials used for the facing give a vitality shade for porcelain teeth. Acrylic gives a dead tooth shade. In case of fixed partial denture and use a ceramic is more aesthetic and more normal than the acrylic teeth. Provide more stable occlusion, fixed partial denture. No any movement in the fixed partial denture. It has a splinting action, while removable partial denture may be cause mobility of the teeth. Partial denture lead to mobility of the teeth due to unstable and unsupported, because the fixed partial denture will stable and cemented, so don't have any mobility in this teeth. 6. Not irritant or apply a pressure on the tissue. As we know, the bridge will suspend it, not loaded a pressure on the soft tissue. The fixed partial denture, psychologically, the patient will feel a normal teeth, natural teeth, not mobility and not excess, rather than removable one. 8. Fixed partial denture is preferred to be used in the epileptic patient, while the removable partial can contraindicated because of the fracture and inhalation. Because the fixed partial denture, it's same as a natural teeth, without movement, without fracture, without maybe inhalation. 9. The bulk of removable partial denture may include difficulty in speech, especially in lower anterior teeth, while in fixed partial denture, the size of the bone tick is similar to the size of the teeth that replaced it. All these cases, the fixed partial denture have a shape and size and anatomy of the natural teeth, so the patient is very compatible with the patient. 10. Badly tilted abutment teeth may interfere with the construction of partial denture. With the mental or fixed removable bridge or proximal half crown can be used in this condition. 12. Fixed partial denture is more stable for the handicapped patient. In case of handicapped patient, the fixed partial denture is very safe because fixed can be removed. Anatomical limitation of removable partial denture. In case of abnormal large tongue, can be used removable partial denture, and tori in the palate and mandible. When we have tori in the patient, can be do a major connector in the partial denture. Muscle disorder, it's very disadvantage in the removable partial denture because the muscle will lead to removing of the removable partial denture. Contraindication of the fixed partial denture. In case of long span, because the abutment can't resist the long span. Free end extension area. In case free end extension area can't be replaced by the fix because the long cantilever bridge, it's not safe and not success. 3. Abutment teeth with the unstable bone support. In case of abutment teeth, its mobility and have a periodontitis can't be used as abutment. 4. Short interjaw space, short teeth. In case of short teeth, can't be get a good retention and good connectors. Patient with excessive bone loss, especially in the visible anterior teeth, because the bridge will have an acceptable appearance. In case of more resorption of the bone, in this case, it should be replaced the gum with the tooth. It's better do the gum with the removable partial denture. Age of the patient, fixed partial denture should not be used for the patient under 18 years old, since after this age the teeth have large pulp exposure. Also, subgingival finishing line will become supragingival after years because teeth not completely erupted. So we should be use acrylic temporary bridge without metal. Also, do not use a fixed partial denture. Under 18 years, the tooth is not completely erupted and not completely fixed, arranged. So we use a removable partial denture. And under 18 years, the teeth will have a large pulp chamber. So this is a disadvantage in the preparation. When we do a preparation, maybe have a pulp exposure. 7. Patient with the dry mouth xerostomia created a poor environment for fixed partial denture because of great risk of recurrent caries. So we use a removable partial denture. Occupation and habits limitation affect treatment. Paroxysm may be lead to apply force on the bridge and lead to maybe fracture of the bridge. Financial limitation, as we know, the fixed partial denture is very expensive than the removable partial denture. Abutment teeth and root. Since the abutment tooth carried an extra load on the root, and teeth should be evaluated for 3 factors. When we do a fixed partial denture, should be check the abutment teeth and root that be used as abutment teeth for the bridge. Number 1, crown root ratio. The crown root ratio can be diagnosed by the X-ray. It should be 2 to 3. The size of the crown 2 and 3 the size of the root, or at least 1 to 1. This depends on the opposing teeth or with the mobile opposing teeth, artificial teeth, or periodontally weak, can be depend on the 1 to 1 ratio. Any teeth have a root shorter than the crown can't be used as abutment teeth for the bridge. Second, root configuration and alignment. A root wider labiolingual than mesiodistal is preferable more than the root that has a round cross section. When we have a root have a round section, this root have a round section, it's easily to rotate. But in case of root have a labiolingual dimension more than the mesiodistal dimension, it's good for used as abutment teeth. B. Multi-roots posterior teeth with the widely separated root will provide better support than root that are covering. Fuse or conical shape. multi-root tooth and separated multi-root roots. It's good for used as abutment teeth. C. Roots with some curvature in the apical third is preferable to that has a nearly perfect taper. It's very good because have a root give more support to the as abutment teeth. D. Well-aligned abutment teeth will provide better support than malposed abutment teeth. Good alignment of the adjacent teeth have represent a good abutment for the bridge than the malposed teeth. The root surface area. The root surface area, it's the area of periodontal alignment attached of the root to the bone. This is the definition of the root surface area. Root surface area is the area of periodontal alignment, the periodontal ligament attached of the root to the bone. The combined root surface area, periodontal area of the abutment teeth should be equal or more than that of the combined root surface area, periodontal area of the teeth to be replaced. This is the Ants law. This is the definition of the root surface used in the Ants law. The Ants law say the root surface area of the abutment teeth has to equal or surpass that of the teeth being replaced with the Pontic. We take example for understand this Ants law. When we missing a 4 in the upper in this picture, this in the lower mandibular teeth. In mandibular teeth, when we take example, the lower 4 have a 1.2 root surface area. This 1.2 can be replaced by the 5 because the 5 have more than 4 root surface area. So in this law we can use to resistance of the abutment teeth to carry the Pontic. So the lower teeth central have 1 root surface area, lateral 1.1. The canine have a 1.7. So the canine can carry the as abutment Pontic of the lateral and 4. The other physical or mechanical consideration is biomechanical. In case of biomechanical, the span length is very important. The span length. All the fixed partial denture flex slightly when subject to the load because the occlusal load, mastication load, continue act as a flex on the bridge. The longer the span, the greater is the flexing. Excessive flexing under occlusal load may cause a failure in the bridge, which lead to fracture or porcelain breakage of connectors, loosening of the retainer, the bending varies proportionally with the cup of the span length. For example, 2 teeth span will bend 8 times compared with the 1 tooth span. So the 1 Pontic is more successful than the 2 Pontics. When a long bridge is fabricated, the pontic and connector should be made as a bulk as possible to get optimum rigidity without jeopardizing the gingival health. In case of long span, should be reinforce the connectors and pontic to resist the flex of the fixed partial denture. In these pictures, number one pontic in the fixed partial denture is more resistant and not flex such as the two pontic. In case of three pontics, the bend and deflection of the bridge is maybe occur. So in this case, should be reinforce the bridge by using rigid materials and give more bulk to the connector and pontic of the bridge. Thank you very much.